Birth is one of the most natural things in the world, yet it's surrounded by misinformation. Some of it's been passed down through generations, some from the media, and some even from well-meaning friends or professionals. But here's what I want you to hear today. Your body is not broken. You are not weak. You don't need to fear birth. So let's clear the fog so you can move forward with confidence and clarity. And in this video, I'm going to debunk the most common myths surrounding births. Let's start with myth 1. Birth is always excruciatingly painful. Now this one is everywhere. TV shows, movies, dramatic stories. Birth is painted as this uncontrollable, unbearable experience. Now here's the truth. Yes, labour is intense, but pain doesn't always equal suffering. How you experience birth depends on your mindset, your preparation, and the support around you. Now, your body produces endorphins, which are natural pain relievers. They can make contractions feel more like waves of pressure than of pain. Now, I had a client who expected agony because that's what she'd been told her whole life. But we practiced breathing, movement, and visualization. And when labour came, she found it powerful but not frightening. Pain is subjective, and when you work with your body instead of fearing it, everything changes. Now next, I want to move on to myth number 2. You have no control over your birth experience. Many women feel like labour is something that happens to them, but that's not true. You do have choices. So you get to decide who's in the room, you decide how you move, what comforts you, and what interventions you consent to. Your birth plan matters. It helps you express your values and preferences. Now, for example, I had a client who was told she had to be induced at 39 weeks. But after asking a few questions, she learned it wasn't medically necessary and she felt empowered to wait and let labour begin naturally. Now, not everything is predictable, but you have more influence than you might think. And knowledge gives you back your voice. Okay, let's move on to myth number 3. Lying on your back is the best way to give birth. So in most hospital scenes, you'll see women giving birth lying flat on their backs, but this isn't the most effective or comfortable position. Lying down works against gravity. It can make pushing harder and longer. Upright or forward-leaning positions like standing, squatting, or being on hands and knees open the pelvis, helping baby to move down, and also helps to reduce pain. Movement is your tool, so use it. Okay, we've got myth number 4. Epidurals are the only real pain relief option. Now, epidurals can be helpful, but they're not the only way. And they're not always available, and they're not always wanted. So you have lots of options to support your comfort. You've got breathing techniques to ease tension, warm water, so think baths or showers or a birthing pool, counter pressure and massage, and you've got hypnobirthing and visualization. Even with an epidural, you'll still benefit from tools like positioning and relaxation techniques. So back to one of my other clients again. She planned on having an epidural but laboured so quickly she didn't have time. So instead she used deep breathing, warm water and movement. And she actually surprised herself with how capable she felt. So this leads on to being prepared with multiple strategies, gives you the flexibility and confidence no matter how your birth unfolds. Next, we've got myth number 5. C-sections are easier than a vaginal birth. Now, this belief is more common than you might think, especially among women who are anxious about vaginal birth. Now, here's what's important to know. A C-section is major surgery. Recovery is typically longer and more complex. C-sections are sometimes necessary and they are life-saving, and they can be positive experiences when planned, but they're not an easier option by default. You might find if you're terrified of a vaginal birth and you want a C-section, make sure you look at all the information. Every birth method has pros and cons. The goal isn't to avoid something, it's to be informed, prepared and supported in whatever path is right for you. Okay, let's just take a minute to reflect. What's one birth myth you used to believe? How did that belief shape your fear around birth? What's a new truth you're holding on to now? Now, the main things I want you to take away from this video is pain in birth doesn't have to mean suffering. Your mindset and tools matter. You have more control than you think, even in a hospital setting. And birth doesn't look just one way. Being informed is your power. Now that we've untangled some of the biggest birth myths, it's time to go deeper. In the next video, I'll guide you through a powerful fear release practice. You'll take everything you've learned so far and start to shift your mindset in a practical, lasting way so you can meet birth with calm and confidence. If something clicked for you in today's video, share it in the comments. What myth did you let go of? What feels clearer now? And if you haven't yet, hit subscribe so you don't miss out on the rest of this series. You're doing such important work here, learning and choosing empowerment. I'll see you in the next video.